Hello, I'm Dr. Phani Madhuri, Senior Obstetrician and Gynecologist and Infertility Specialist at Apollo Cradle Hospital, Jayanagar, Bangalore. So here we have an interesting patient who had a very rapid growth of a mass called fibroid in the uterus. So she came to us with the size of the fibroid being around 38 weeks size pregnant uterus, which is almost extending till her chest. She had difficulty in breathing. She barely could sit like this. She was having difficulty in walking, lying down. Her life had become very paralyzed. Now she comes with an interesting history of very rapid growth in the mass just over the last couple of months, which is a warning sign for us to always think of malignancies in these cases. Generally, 99% of these fibroids are benign, but less than 0.1% of them can be malignant and can be very tedious to the patient and to the surgeon. So keeping that risk in mind because of her age and rapid growth of the mass, we took all the necessary precautions to understand what we have to do to give her the best outcome. So we planned the surgery, an elective surgery with the best of the anesthesia care. We had to induce her with general anesthesia, and we performed the surgery of removal of this huge mammoth fibroid from the uterus. So we successfully could remove the fibroid from the uterus, saving the uterus, because this was a patient who had visited multiple doctors who scared her that she could have a risk of losing her entire uterus because of the size of the mass and risk of heavy bleeding. So what we did to prevent or to reduce the risk of bleeding was we had to ligate both the internal iliac arteries, which drastically reduced the amount of blood loss during surgery, and the patient could tolerate the surgery very well. We had to give her blood replacement because she had a lot of blood stored in the mass itself, which was roughly weighing nearly about 6.5 to 7 kilos. So she lost that blood, which was replaced, and here we have patient who has recovered very well 2 days later the surgery, ready to go home. So this has been a beautiful story of patient Sushismita, who has given us this opportunity to serve her, and we are more than happy to have had such a successful outcome.
My stomach was little hard, but I was not feeling anything bad about it. There is no other feeling apart from that. But within these 2 months, suddenly it was like I was not able to sleep properly. I was not able to breathe properly, and there was some once or twice there is bleeding from my nose. Weekly it's 3-4 times, and also there is problem in motion. So yeah, I visited maybe 4-5 doctors for this, and at the last, because at that time I was also pregnant, and one of the doctor also said that there will be no issue with the fibroid, you can concentrate on your pregnancy. So for couple of days I was also feeling I wanted to save my pregnancy as well. So for a couple of days I was like, okay, I'll try to concentrate on my pregnancy. I will just neglect this pain. But when it was unbearable, I got to know from my brother, from his friends, I got to know about Phani Mom. So yeah, then whatever she said already, I'm telling it now.
Thank you very much, Suchismita. This was a wonderful outcome, and we just want to enlighten this story so that patients are aware of this condition called fibroid uterus and try to always address this situation when the size is small. It is always a beneficial outcome when the sizes are reasonable in terms of hemorrhage as well as the recovery from the surgery. So, don't allow the masses. Always keep a check on the size of the growth of these fibroid masses. So whenever you see a rapid growth, it's a warning sign, and most of the times you need to visit your gynecologist and address the problem ASAP. Thank you.